Paging Mr. Cronin.
Okay, I need a motion to approve the consent agenda.
I would like to remove one item from the consent agenda, the personnel report. And later on, I'll explain why.
Okay, I need a motion to approve the consent agenda with the removal of the personnel items.
I so move.
Do I have a second?
Seconded.
And for those people that are watching the recorded meeting, our consent agenda is this evening consists of the approval of minutes, approval of the list of bills, approval of the treasurer's report, the motion to destroy closed session recordings, the approval of, we'll go to notice of FOIA requests, and the second reading of policy 5205, code of conduct.
Can I have a roll call, please?
Mr. Sartorius?
Aye.
Mr. Skorzynski?
Aye.
Mr. Blount?
Aye.
Mr. Cronin?
Aye.
Mr. Shaneberg?
Aye.
Voss?
Aye.
Ms. Conquest?
Aye, motion carries. Next, I will need a motion to approve the personnel report.
I'll make that motion that we approve the personnel report, but a little explanation, because each month I do the same thing. You know, the personnel report is really important to me, and to a lot of people, employees that we have in our school district. I know it's important to pay the bills, and I know it's important to have the treasurer's report, but these are actual people we're talking about. And I think this is important, and I think it needs to be pulled out of the consent agenda every month. So that's why I make the motion that we approve it the way it is. But these people work for us and they do a fantastic job.
Can I get a second to Al's motion?
I'll second that motion.
Before the roll call, I'd just like to explain that our personnel report this month contains the employment of several employees, mostly non-licensed support staff. There's one leave of absence, there's a small number of resignations and then transfers. But it also contains this month a contract to bring back a familiar face in an interim role. With the resignation of our assistant superintendent over the summer, we reached out to Dr. Kathleen Cheserek, who recently retired as principal of one of our elementary buildings and has agreed to come back as an interim chief academic officer to fill the roles and responsibilities that we were going to be missing this year. So welcome back, Dr. Cheserek.
Welcome back. Roll call.
Mr. Skorzynski?
Aye.
Mr. Shaneberg?
Aye.
Mr. Blount?
Aye.
Mr. Cronin?
Aye.
Mr. Sartorius?
Aye.
Ms. Voss?
Aye.
Ms. Conquest?
Aye, motion carries. On to our action items. First up is the adoption of the 2021-2022 budget.
So Mrs. Robinson is going to come up and walk you some of through the last details and changes that may have occurred. But I'd like to just kind of start off by saying that this is this month's main action as we start getting back into talking about our strategic plan, because we've had to be so reactive to everything that's happening. We often lose sight of the strategic goals that we've set for our district. And our fifth strategic goal involves, fiscal responsibility and efficient operations. And so we are pleased to essentially be bringing you a balanced budget tonight that should again qualify us for the highest level of financial recognition that the state has. So nice job, Mrs. Robinson. And if you would walk the board through the item.
Good evening. So we have the final budget being recommended for board approval. As Dr. Mon mentioned, there's a minimal operating deficit of around $31,000, but the budget does include $100,000 of contingencies. Since our last meeting, we've just had a few minor changes. That's where you'll see the difference of what we've brought in our preliminary budget. The details are provided as the backup, but if you look at the summary chart, just a few things to note. Fund 10, we do have a large deficit in our education fund this year, and this is largely due to the multi-year curriculum purchases that were board approved in May and June. So we don't have a concern moving forward. We plan on using those curriculum materials, again, over multiple years. Some of them involve multiple subscriptions. So that is really what was making that fund in the deficit. And then we also have somewhat of a larger surplus in operations and maintenance fund, which we don't normally see. But that was just due to some timing of the ESSER funds. So as you recall, we did the large air purification project in last year's budget, but we didn't receive the revenue until July. So that's where we're seeing that it was around 450,000. So we see the surplus in the fund this year. So again, unless there's specific questions, I listed out some of the specific revenue and expenditures, but they haven't changed since last time. So I would just take any questions at this point. Or if there isn't any questions, we would ask that the budget be approved as presented.
The official motion is the adoption.
Adoption,
Yeah.
sorry.
So for the education fund, the 1.3 million, make different accounting, we account for it in subsequent years? The 1.3 that we're spending this year? Or, I'm not sure what I'm saying, but it's just, do we get some kind of credit? If this
No.
is for multi-year, that's a one-time purchase, but
No, we chose
That's
to make,
Go ahead.
we chose to make the purchases out of this year's budget, and we are on a cash basis. So the cash is coming out this year. We'll just have the benefit over the next multiple years that we won't have to be spending that. But we invested in a curriculum, in new curriculum, and it was a change, and that doesn't happen every year. So no, we won't be refunded. It's just out of that fund balance that.
okay. That's all I had. Thank you.
Other questions for Mrs. Robinson that we didn't ask at previous meetings?
I move to adopt the budget as presented.
I'll second that motion.
Okay, can I have a roll call?
Mr. Sartorius,
Aye.
Mr. Shaneberg,
Aye.
Mr. Blount,
Aye.
Mr. Cronin,
Aye.
Mr. Gorzinski,
Aye.
Ms. Voss,
Aye.
Mrs. Conquest.
Aye, motion carries. Moving on to the intergovernmental agreement for Shield COVID-19 testing.
So the next two items, so this action item and the first discussion and info item are kind of going to bleed together. So if you'll grant me a little leeway here. So clearly, since our last board meeting, we've gotten kids back into our hallways. We've gotten kids back into the classrooms with the teachers. And as we heard plenty in public comment, one of the most concerning things that occurred was just the sheer number of students that have had to be quarantined already this year. Every time that we get notified of a positive case, yes, the schools go through the work of contact tracing on both the buses, in the classrooms, in the music, in the art classroom, in the cafeterias. And they do their best and work with the county health department to make sure that we are contacting and only isolating or excluding the students that we know were within a certain amount of space of those students. Early on in the year, the mitigations and the definitions of what they called an outbreak changed from 5 positives within a location down to 2 linked cases within a location. And that spurred these bus quarantines that we saw, where 2 students that may have been sitting near each other in a bus that, close contacts might be able to solve, because of the definition and the way that it was being interpreted by our health department, it took out the entire bus of students. Parents were angry. Our schools were angry. We didn't want to have that many students out on quarantine. And so we have been engaging with our health department weekly, daily, often late into the evening, just trying to make sure that we're having a rational conversation about the best way to safely isolate and exclude only the students that we need to, and to find ways of keeping healthy kids in our classroom. And so we were very pleased that late last week, they announced that they were going to be reinterpreting their definition of outbreak, where they're still going to call 2 linked cases in a location as an outbreak. However, they're going to allow us to only isolate those people that we can define as close contacts within a proximity, whether it's 3 feet in the classroom or 6 feet in some of the other non-classroom spaces. And that truly will prevent us from having to take out a bus full of 60 kids when we might be able to only know that maybe 8 students were actually nearby in that region. And the other change that we didn't even really put in the communication because we didn't want it to be too long and overburdensome is that they have agreed to allow outbreak testing now as well, to give families a way to get out of a mandated quarantine. Normally, when you're just identified as a close contact, there are different test to stay options. And we'll talk more about the actual phrase test to stay, but they've been able to, either 10 days if they're asymptomatic, or they could even return after the 7th day if they were able to obtain a negative test. That wasn't allowed during a definition of an outbreak. They were making students isolate for a full 14 days, an entire incubation period of COVID-19. After we kept working with them and talking about the effect that this was having in our schools, they agreed to implement I believe it was twice a week outbreak testing program that could help us keep healthy students in the classrooms, not having to be at home with remote or synchronous instruction. So we've really made some great progress and great collaboration with our health department to find ways of keeping more kids in the classrooms and stop having to send so many students home to engage in now synchronous instruction after we made that shift last week. The other big thing that has changed since our last meeting in August, and I think we even reported then that we were going down the path of securing on-site testing and exploring how to get that in our schools. That really ramped up in the past few weeks. And I'm pleased to say that we are already enrolled in the Illinois Shield program, which is what this intergovernmental agreement will go to, as well as we are in the process of implementing also the Binax Now rapid tests. And I know Dr. Staub is going to have a whole presentation about new testing protocols in our schools that we can have in place to keep students there and and even for the new staff mandate that is coming out. So we're very excited, and we've done a lot of great work. And even today, I was able to go to Grundy County and get our first batch of 1,000 Binax Now tests. So we have tests on site. Our nurses are going through, I think, what should be the only required training that they need tomorrow. And so by Wednesday, at least with staff, we should be able to implement. And then it's a matter of setting up a student system. But I don't want to take too much of the information you've already prepared, so I'm going to let Dr. Staub go through a presentation on testing.
Thank you. You did kind of steal some of my thunder with some of these exciting announcements that we've made. Dr. Mon actually texted me. I had a vacation day today, and he texted me while I was at my son's golf meet, and I did like a cheer in the middle of the golf meet, which really isn't allowed, because I was very excited to hear that we had tests on site. So some of our testing updates. This has been something that has been in the works. Aaron, are you seeing this on there?
Can we get that on the screen, please? Thank you.
Oh, am I not sharing? Okay, so this has been in the works since this summer, honestly. We began going down the road of COVID testing as a school district, and recently we were allowed to begin the test to stay method. So the test to stay method is for a close contact that's a non-vaccinated individual can test on days 1, 3, 5, and 7, utilizing either the Shield testing or Binax Now testing through the district. So as Dr. Mon said, we already have the Binax Now testing in-house. The Shield testing, we are working on that intergovernmental agreement, and we will need to do a couple, maybe about another week and a half to 2 weeks of working with Shield to secure all of the regulations for that. Any student must opt in to participate in test to stay, so this will not be something that we can just provide to a child without a parent already giving us permission to. If an individual is deemed a close contact and not fully vaccinated and has already completed the opt-in process, the school will begin testing and can contact the parents with the results. Shield testing, the students may return to the classroom while they're awaiting the results. If a positive result is received, then the student would be removed and we would follow the isolation timelines. Binax Now testing, students may return to the classroom after the 15-minute waiting period to receive the results. If positive, again, the school would contact the parents with the timeline of isolation. Outbreak testing has a little bit of a different timeline, and this was just updated Friday, I believe. If a non-vaccinated individual has been exposed through an environment that is deemed an outbreak, and again, right now, IDPH is considering that 2 positive individuals in one environment. The individual may participate in outbreak testing. The testing must occur once weekly, and testing must continue for 1 incubation period, which would be 14 days from the outbreak exposure, as long as no new cases from that outbreak environment have popped up. If it does, then that incubation period starts over again. Testing must be conducted by the school for outbreak testing as well. 2 different testing methods, and it's very important for us to have the 2 different methods because, like we said, there's so much testing that would need to occur with either of these, either the outbreak testing or the test to stay model. Testing through the school environment, it's free to the individual. It's provided through IDPH and the SHIELD project through the University of Illinois. It is a PCR SARS-CoV-2 test, often referred to as the spit test. Parents, again, must complete that SHIELD opt-in letter, and then results will be shared with the designated district supervisors and the family through the SHIELD online platform. Results will be posted within 24 hours of the specimen arriving at the SHIELD collection site at Illinois State University. So with SHIELD testing, we do need to deliver the test specimens to Illinois State University, and it'll take 24 hours from those results getting there for us to receive the results through the online platform. Binax Now, again, that's going to be through our district. The testing would be through the school environment, free to the individuals. The tests have been provided through IDPH and the Will County and Grundy County Health Departments. It is the Abbott Binax Now point of care test, often referred to as the nasal test. Parents must complete a Binax Now testing opt-in letter. Results will be interpreted by our trained school professionals and entered into the IDPH Red Cap system. And again, those results take about 15 minutes to receive. So that's a quicker test result than the SHIELD testing.
Can you go back to that slide for just 1 second? We want to make sure we give credit where credit is due, and Grundy County is also providing us Binax Now tests. We picked them up from Grundy County Health Department today, so got to make sure we get a plug for them.
SHIELD testing, like I said, that is it's a long process. So we completed phase 1 at the beginning of August. So we completed an interest survey. We attended the Zoom information sessions. We did a meeting with SHIELD, and then we requested all of the information that we needed to complete the packet. Then we started the sign up, which is phase 2. So all of phase 1 and 2 have been completely finished. Our next phase is onboarding, and this can take anywhere from 3 to 4 weeks. But I will tell you that we have completed most of this already. We are just waiting on responses from SHIELD. So as soon as we get those responses in, then we'll be able to finish the rest of these steps. SHIELD is providing these services to the entire state. So they are working with us as quickly as they can as well. Testing program options. So this is the weekly screening. So with SHIELD, we are going to complete the district collection. So IDPH is actually going to pay us $8 a test to cover the costs that are associated with collecting and transporting the test down to Bloomington at Illinois State University. What's nice about this is this allows us to complete tests and as many tests as we need to on any given day of the school week. So it's pretty flexible for our staff to be able to complete these tests. One component is that our staff will be completing these. You've probably noticed on the consent agenda that we did have many more health aides that have joined our staff, and that is to assist with this testing to allow our nurses to be able to test in-house.
And just to clarify, It says weekly screening testing because that's the slide that came
thank
from
you.
Shield. We are not planning on doing just random screening of any child that consents to testing. We're going to be, the first bullet point, the last sentence says, this option is also useful for schools that want to conduct exposure response testing. That's the boat that we're in. When we believe someone may have been exposed, that's the type of testing we're doing, not just calling down random children at this time.
Yes, correct. We're only doing that test to stay with students. And then the Binax Now testing with Will and Grundy counties. So our steps there were to obtain a CLIA waiver to provide on-site testing. I apologize. We needed to have a memorandum of agreement with Will County Health Department, and then contract with a licensed bio-waste company and obtain a standing order from a physician. And I will be honest, that last bullet point under that obtain that standing order, that was our biggest hurdle in obtaining these Binax Now tests. We had to work, again, Will County Health Department was very helpful for us to complete all of these steps. And then right now we're in the process of completing that training for testing personnel. And then we're registering with the IDPH RedCap system. Chris has already obtained the materials to begin testing. And then our next step is just to collect and enter the testing data as we continue to test.
Just a little bit of background as well. So, I mean, we talked about two different health departments in this process, and the bullet points there that obtaining the standing order from the physician and obtaining the CLIA waiver, that was the hang up that some of the people at the Grundy County Health Department were not comfortable signing off on for schools. So it's that arena that Will County did not have the same barriers to. So we were able to work through the Will County Health Department to obtain the standing order and to finalize the CLIA waiver. Once we had those in place, we can now work with both counties to actually obtain the tests on site. And there's even a manner of getting Binax through Shield too that we'll be trying to implement just to have as many available tests for our students and staff as we can.
So that's all of the background behind how we've gotten from where we were to where we are now to be able to do test to stay. And then as Chris said, also be able to test our employees that are not currently vaccinated, so they will not have to obtain the testing on their own. Are there any questions from the board about our process and the two different types of tests that we're offering?
Yeah, I have a few. I'm not that smart, so you have to bear with me. So first of all, like the school bus example, 2 kids. So first, how do we know that there's 1 kid or 2 kids? Is it just symptoms or?
So that has to go back to a positive test. So when we look at an outbreak, you're looking at 2 positive individuals.
So is that because somebody's not, I mean, they have the symptoms, the parents called in and said?
It could be that perhaps the child had already been exposed and had symptoms and parents were getting them tested, or perhaps the parents had them tested and we found out that they were positive. Sometimes there are students that are sent home for symptoms at school. And then again, the parents would have them tested to see if it's actually COVID or if it's an unrelated illness that with a doctor's note. So yeah, so once we have 2 positives, and I will say our administrative teams at our buildings work very diligently on contact tracing and then keeping up with all of the positives that we have, again, with that incubation period. So we're constantly looking at a 14-day window just to ensure that we are not having outbreaks within our school environment, because we don't want to infect more children or more staff members. We want to make sure that we keep those numbers low so we can keep as many in school as we can.
So if there is something on a bus, are we going to test the bus driver if he or she wants to be? I mean, some of them said, I mean, they don't tonight. I mean, some of them, I don't think they want to get tested, but will we offer a test to the bus driver? Just
if somebody is considered a close contact, they can certainly obtain a test through us.
All right, and then I might have missed this, but what's the definition of an outbreak?
An outbreak is considered 2 individuals within an environment. And originally we were interpreting environment as classroom. And then with IDPH in Grundy County, their feedback was when we had 2 individuals on a bus, that was considered an environment as well. But, and I will say Chris has been, I don't use this word frequently, but tenacious in advocating for our students, especially the last week with the school bus, because we were quarantining an entire school bus for 2 individuals that could have just been close contacts.
All right, and then with, so if there's 2 kids, or one kid has it, and we're testing, so you're saying that if it's 2 kids, 3 kids, or 4 kids, we'll test them, they can stay in school till get the test back. So is that the 15-minute test, or is that the Illinois State test that goes down?
It could be either one, but so long as they get tested, because some parents may not want to do the nasal swab test, but they're comfortable with saliva. So long as they've given consent for the child to be tested, honestly, I think we would almost prefer, depending on quantity and depending on supply. Like if we're very low on rapid tests, we might move people to saliva for a while to, just to save on supply. But the rapid test is much simpler and solves the issue right there and then that, the evidence shows that you don't have COVID. Let's go back and learn. So I would assume that our staff are going to try to use that, but you could burn through the supplies very quickly. And we don't yet know how fast we'll be able to get restocked supplies from these health departments.
And then what is consent? Is it verbal? Is it?
It has to be written.
So we've been working, Mr. Souza has already been working with us on consent waivers to allow parents to opt in to testing. And those parents will be able to agree to one, the other, or both. So if they want Shield or Binax or both of the tests, so they can choose.
Are we
there.
going to proactively send out the consent
Yes.
forms?
Yep.
And then this way they're on
Yeah,
file?
our goal is to have everything on file, so that way if we have close contacts, what our teams have already been doing is immediately we look at close contacts and we see are any of these close contacts already vaccinated, and then we can keep those kids or those staff in their environment, in their classes, and now we'll be able to look and see, okay, can we test any of these kids once we have those opt-in consents? And then our plan is, even if we have, so if we have a kiddo that comes down and they're not vaccinated, they don't have a current opt-in, we'll call the parents and say, would you like them to opt in? Can I send you this to send back to us so we can test your child? And if they say no, then we would have to send the child home for the quarantine period.
Good. Thank you. Great job. Thank you.
For the bus that had the 2 children and then the whole bus was quarantined, do we have a number of everyone else on the bus? Were there any other positive cases at all? Do we know?
We've had 2 buses that we've had to shut down and have since been able to open, I believe, correct? I don't believe there were any additional positives from the bus environments. A couple of the classrooms that we had at Aux Sable, though, we did have positives when we had outbreaks at Aux Sable. We did have several positives from within those outbreaks, but I don't believe that we've seen it on the bus.
We did have a bus where over a 2-week span, we were notified that other students had become positive, but it was linked outside of school. So we didn't know that it was only back on the bus.
Okay, thank you. Are we able to get a copy of the presentation? This one that you present?
Yeah,
That'd
I
be
can
great.
share
Yeah,
it.
I was looking to see if it was loaded in line, so you guys,
Yeah.
words were kind of small on the screen up there. I apologize.
And I'll just share, like, my son actually was sitting next to his friend that did test positive. It wasn't any of these outbreak buses at all. But, so he did quarantine and everything, but, he didn't even get it. So this testing is going to be good, because that was a case, he was sitting right next to his friend, and he didn't come out positive at all or anything.
And that's our goal, is to keep kids, the more kids we can keep in school. We obviously don't want to spread the virus, but
Sure.
any kids that we keep in school, it's important.
Thanks for your work on it.
I do have a couple of questions, or maybe 3 questions. It's more about logistics. So who is going to be performing the testing?
So both of these tests would be completed by our staff here on site. So we have our nurses, and then we're also going to have our administrative staff trained and our district office staff trained.
Okay, because my follow-up question was going to be, do we have enough staff? Do we need to look into perhaps getting like agency nurses or anyone else to help out with the testing and perhaps the contact tracing?
So that's where we added health aides into our elementary schools, and I think we're still short one health aide at one of our buildings. Is that accurate, Miss Massey? I know Miss Massey has been working very diligently at interviewing for any of our vacancies that we have throughout the district. And last Friday, I believe that we still had one vacancy to fill for a health aide.
Well, and then we took the initiative today to post 2 more new health aides to help out at MIS and the junior high, because as you said, just with adding testing to it, with all the contact tracing that's done, the health staff is overwhelmed right now. So we are trying to do everything we can to support them.
And I imagine as we're going into cold, flu season and everything else, not to mention our other students who, may need, may have diabetes or asthma, and tending to them, I just, wanted to make sure that we're not overloading anymore, overloading our staff anymore. And my next question is, logistically, where is the testing taking place?
So for each of these environments, we'll need to have a separate, or for each of the test sites at the buildings, we'll need to have a separate environment. So each of the buildings will be finding a location that they'll be able to do this, where it would be private, and it wouldn't be like out in the hallway or in the main office. It would be a separate private environment for the children to complete the testing.
Now, and we all know we have some very crowded schools, and then the elementary schools have a little bit of space, but they're using every nook and cranny pretty much, including quarantine rooms. We actually could see this happening in the isolation rooms that we're currently using. Because if we're sending kids there to isolate, maybe we can put up some slight dividers for a little bit of privacy and use that as a place where they test and then wait for the results. And then hopefully we can send them back to class. But those rooms are already kind of, warded off from everybody else. So it seems like that could be a very workable solution, but each building will look slightly different.
Sure. And will we, is there any plan to do any piloting, for example, to see how long it takes? I heard it takes a very short amount of time to do the testing. We know with Binex now, it takes, they have to wait about 15 minutes. But for the, I call it drool in a cup because they say you're not supposed to spit, but for the shield testing where you drool in the test tube or the cup or whatnot, explaining that process to like the younger kids, for example. Do you need volunteers, for example, to kind of pull away to explain it and figure out, the timing of everything, how many staff you need to take that time and get them through the process?
I can speak to Binax at least. Like I know, like there's our nurses are going to go through a training tomorrow, and that was one of the reasons that we wanted to get tests on site, because we don't want to use a ton of stock, but they can at least use a few of them as control, experiments to make sure they understand exactly where the reagent goes, et cetera. So that's taking place tomorrow for Binax, and then you can speak to SHIELD if you'd like.
Yeah, a part of the SHIELD protocol for the training, I don't know if it's considered a pilot, but there is a part of that that's part of the SHIELD training, is making sure that all of the staff understand how much time it takes and how to collect the sample.
Excellent, thank you.
I have one question down here. How many kits do you think we'll need initially? Or how many will we go through? What are we looking at volume here?
So we estimated, and this is our initial estimate, when we started the application for the CLIA waiver, that we would probably need about, I think we said 7,000 tests, correct, Chris? For the Binax test. But we're going to have to continue to monitor that number and see if that's realistic. From what we understand, they don't have a short shelf life. They don't have to be refrigerated or anything like that. So we believe even if we do over order right now, that we will utilize them throughout the year. And then as our stock becomes low, again, we'll have to be very watchful of that to ensure that we have enough tests on site.
And how about the SHIELD test then? Is that the one? That's not the one you just said, is it?
So the SHIELD test, we are waiting to hear back from our relations manager and work through all of those numbers based on the data that they collect for a district our size using the test to stay model. They'll help us determine how much we'll utilize.
There was an article in the Chicago Tribune Friday about that. And apparently U of I is overwhelmed right now with the number of school districts that are applying and ultimately receiving all these things. So we'll be able to start with the other type before we go to Shield.
Yes,
Okay.
and again, that's where it's very important for us to have the variety of the tests, that if we run low on one supply, then we're able to offer a test.
I'm sorry if I missed it. For the training tomorrow for the healthcare workers, can you give us an idea on what that looks like?
So they'll complete the modules for the Binax Now, the Binax Now testing. It's a 6-module series of videos, and then they'll work with our head nurse, Amy Pelnarsh, to practice utilizing the tests and understand exactly what we do, how to read, so the swab is just a swab. There's nothing on the actual swab itself. It's when you utilize the swab, after you utilize it in the nasal, you put it in a test kit, and then you add the reactor to it, and then it'll read the test from there. So there's that component of actually completing the test and reading the results, and then there's a component of entering the results in the REDCap system.
Thank you.
So I have 2 questions. I can ask them together. So this is new for us, doing testing on site, of course. And once we get to test to stay, are we only accepting tests done on our premises? If you on day 3 or 5 and there's holidays or weekends or emergencies, once you're in the program, is it only on-site tests that we're going with? And secondly, in the case of conflicting tests, if a parent's not happy with our test and gets their own test, do we have a plan if that were to occur, like a 3rd test, or what would we do with that?
So the first answer is one that I don't like having to give, but we're being told that the only option for the test to stay on days 1, 3, 5, 7 has to be done on site at school. I don't understand the rationale for that. I have argued with them that if a medical professional out here is going to give the same test and can get a negative result, why does it matter if it's done in my building or in a medical building? So far, I have not gotten them to move on that. So test to stay has to be done on ours, as does the outbreak testing, if you recall that slide. When there is an outbreak and they're actually involved in a close contact, it says the tests must be done at school. I don't get that, so I'm still going to argue it. But yes, right now they are saying that. Now, if a student had a positive result from one of ours, like the Binax Now it's approved for test to stay in this. But if they were to go and get, I'm going to get the wrong initials right, but the PCL, is that what it is? PCR, if they were to get one of those, I think we would allow that to override the result of the Binax Now. If they got a negative PCR test, I believe that would qualify for, I don't know if they could use that for test to stay because it wasn't done on school, but at least they could come back after the 7th day, right? These are like all these conflicting testing days, so.
There's many different testing guidelines and timelines that we're able to follow. So what we're currently following is that if a student has a negative test result from day 6 onward, they would be able to return to school beginning on day 8 of being exposed. But if we add this test to stay, then that could allow a student to or not have to miss any days at all.
Just to follow up, would we be able to discuss it another time or consider if the cases or the situations arise where students are wanting or needing tests and we're not quite meeting that need, could we be open or available on weekends or evenings so it's on site, but it's available not during school hours?
I think that's a wonderful idea. We would just need to make sure that we had available staff that were willing, or it would be our administrative team, as we're all going to be trained as well. But yeah,
like
I mean, I think we would want to work with people to find a way to keep them in school. So,
like I said, I'm not sure that would be necessary, but for us being testing and new, I think that we should think outside the box, and we can be on site, not just 7 to 3.
So if a family wants to do the test on day 6 that currently exists, they can obtain that one either at school or outside, or do they, and with that question, does the parent need to bring them to school to get that test? Are we letting those students come on the bus before we know the result of the test? Or how does that process
So
work for families?
If it's a child that's currently a child that's quarantined and has not already had a negative test, they would need to have the parent bring them to school to complete that. But yes, we would allow that one if the parents chose not to participate in the test to stay. But our goal is, as soon as we can allow this, we will offer the test to stay, which again would allow students to remain in school or return to school.
And I honestly, I don't see that scenario developing, because if a parent is willing to test them on day 6, I don't know why they wouldn't have allowed them to be tested on 1, 3, 5, and 7. So it's likely that so long as they're asymptomatic, they've been staying with us. But it could.
Yeah, I could just see them not wanting the number of tests or something for their child. But, and then the other question I had is, the test to stay program is only allowed when masks are required, correct? So
Correct.
as things move forward, you know, that's something we just need open communication with our families, that we are able to provide it because we have mandated masks. And if that were to change, our testing protocols may have to change as well.
Yeah, and I mean, some of you may recall last spring is when these tests first started becoming available to schools free of charge. Last spring, there was no test to stay option. So even the test that you could do on site, it was almost just to give parents an idea if their student had COVID or not. So even if you got a negative rapid test at school, you still had to send them home until they obtained a negative PCR test. So we didn't implement this in the spring because, well, the health offices were already overwhelmed, and this was just going to be adding something else to it. Then in the summer, we were going mask recommended initially. And when they first came out with this test to stay plan on days 1, 3, 5, 7, but it only mattered if masks were universally required. And that was not the route we were going in the early portion of the summer. So it wasn't until suddenly a mask mandate came out that we started like going down the test, because now they decided that these tests could be used to keep people in school. So yeah, I mean, we've been working on this since the summer, but yes, it's the change from last spring that kids couldn't have stayed in school with these tests that caused us now that we can use them to not have to send kids home. That's a big shift for us.
One other question I had, so once we have test to stay implemented, any student that's considered a close contact but is doing test to stay and is negative will not be on our COVID dashboard as a quarantine. So districts that have the test to stay don't have those students participating in the program, you know, counting as a quarantine number. So I would anticipate that our numbers will drop greatly.
Correct.
And then I have another question. Will there be some sort of, I know there will be a communication to our families, but kind of like a very basic cheat sheet so that they understand, you know, all of the different testing options, that it's very clear cut and easy to absorb.
Yes, we've started working on not only the opt-in communication, but also the communication about the testing. And then we'll also be updating our website. Once we wanted to hold the board meeting first and make sure that the board is okay with us moving forward with all of these options. And then we'll be updating our website where we have all of that information. So there will be a very simplified sheet about the test to stay options.
And I have one more question. Will we be providing transparency, like daily, weekly, monthly, how many tests were done, or do we need to do that? How many tests we've done, how many are negative, how many are positive? I don't know if that's something that Grundy wants or Will wants. Or the state
Oh,
of
we have to
Illinois
we have to report positive test results to the Red Cap system is what it is for Binax. And then Shield is obviously a system that is going to have their own database. We have not yet discussed if we're going to add, you know, number of tests to our COVID-19 dashboard or anything. I mean, it's a conversation we could have, but I think right now we're worried about getting it started. And then if somebody else is deemed positive from one of those, we'd probably still recommend that they go get, you know, a PCR test to confirm before we add it to our numbers as an additional positive case. But again, we're trying to get it implemented, and then we'll see how some of those things fall
I
out.
was just curious if, like, if you follow, if we're at below the national average, above the national average as far as percent of COVID tests that are positives. Curious.
On that note, I do have one more question, I'm sorry. So if, if a child gets a Binax now, gets a rapid antigen test, and do they have the opportunity, you know, once you communicate with the parents, then to follow up at school with a shield PCR if if it's deemed necessary?
Are you asking if it's
Yeah, I mean, I don't think we would stop them from also taking, like if that one comes back positive or even if it's negative and they're worried that it's a false, like at that point, we might just advise them, if you're worried about that, just take the shield. And, you know, so long as you're asymptomatic, you can go back to class. We'll have the results within probably 24 hours of it reaching the lab. So within 36 to 48 by the time we deliver. But, you know, so if someone is worried about that type of thing, if they want the confidence of a PCR, maybe that's the route that they should go. But
I have one last question too. So I'm hearing a lot in the community of difficulty obtaining tests. So I think this is fantastic to have. What about the case of a symptomatic student who was not deemed a close contact? Obviously, we wouldn't want to bring a symptomatic student on the bus or into school, but is that something that is offered through this program, or would they still need to obtain a test outside of school and bring a result to school?
So this only applies to close contacts and non-symptomatic individuals. So if somebody is symptomatic, they not only need that negative test, but they also need an alternative diagnosis from their doctor to confirm what those other symptoms are a result of. So they would still need to follow through with that.
Close contact from school qualifies for it, or like a student who found out they were close contact from, you know, a sport or a family gathering or something like that, do they qualify?
I believe that they would qualify for it through the school, because if they're deemed a close contact, we would want, so if my son was at baseball and he was deemed a close contact from baseball, I believe that we would honor that, but we haven't had that internal discussion, so we would have to maybe get back to you on that.
Thank you. Any other questions?
there's one other angle before we start to move to something. So the other thing that has changed recently that we're all aware of is the governor did put out basically a testing mandate for staff, which they would have access to test with us here. The deadline for that is this week. They have to submit to once a week testing. We gave our employees a grace period of all the way until this Friday to actually submit some evidence that they have gone to get a test. But as we heard in some of the comments tonight, we do have some employees that have indicated that they just do not intend to comply. We don't know if they will follow through on Friday or not, but the bus driver shortage is real. You know, we could have anywhere from an additional 4 to 5 staff members that decide on Friday that, you know, we can't let them continue to work for us after Friday if they don't submit to a test based on the executive orders coming. And they have no intention of doing it, so we could be down an additional 5 drivers. So to the community that may be watching this meeting, please, if you know of anyone that is willing to get a CDL, has a CDL, we will train, but we need humans. We need people to drive buses. It is a real shortage. And this testing mandate is possibly going to have the unintended effect of taking some people out of that workforce that were otherwise willing and have been good bus drivers for us for quite a few years. So one other communication that we may be sending out this week is like, please be patient. We are doing our best. We will get kids to school. But there are only so many drivers that report on a given day, and transportation is having to piece together a lot of different, you know, staffing measures. And the 2 districts have been helping themselves out tremendously. As a few of the drivers said, like 201 drivers are almost every day driving some route for the high school in between what we can do. Whether it's just a shuttle from South Campus before they have to get up to run an elementary route, or the high school drivers are running a junior high route before they have to get down to South Campus. So it has truly been a good collaboration, and thank you to all of the drivers, both of our district and the 111 drivers that are helping. Thank you to the transportation office staff and the mechanics who are driving 3 routes a day probably. There's times where the office is empty and we have to reroute calls over here to district because every available person in the office that, you know, has a CDL and is out running routes. So we have reached out to the high school to continue on how we can collaborate and possibly create some other solutions as a last resort. But it is real. So please know we are doing our best to recruit new drivers. I think We said we called every former transportation employee that we've had in the past 3 or 4 years to see if they were interested. I think we got 3 that might be interested. One of them did not want to commute up from Florida, so we offered to pay mileage. It didn't work. We sent out a flyer. I can't remember if it was just social media or if we emailed that to all families. There it was. I'm getting the head nod. I think we got at least 12 inquiries from that. So we are some people are showing interest, but it does take a long time to train a new driver. So it's not going to have an immediate impact. So please be patient. We will get kids to school. It may just take a little longer. It may be a few minutes late. Hopefully it's not more than a few minutes late, but they are working very hard. So that was the update I needed to make sure I got out there. I don't know, Ms. Massey may talk about the staff testing in her report, but happy to take any questions, or other people may be able to answer if I don't. Otherwise, we do have that IGA that we do need action on.
For the to try to help incentivize and not to make the budget larger, but obviously it's a problem to try to retain the bus drivers and trying to recruit new bus drivers. But have we looked at like exploring possibly raising the pay at all?
So our pay is still very competitive, especially because we kept the bonuses that we implemented last year. We implemented a $1,000 bonus if you already had your CDL to try to attract people that could immediately impact us. And this was from like the February timeframe where we almost couldn't reopen our schools because we didn't know if we had enough drivers that were going to report. We also created a $1,000 retention bonus to stop our employees from, getting picked off by other districts. We have talked about there's only a few other areas where we might be able to incentivize, but we might have gotten 12 to 15 new inquiries right now, so that would go a long ways to helping. But yes, if this continues and this does impact, I could ask the board to consider, one additional, I don't want to announce it right now, but we have one other avenue that we're exploring that, might be able to incentivize some drivers from other areas to join our staff.
And I know that communication has went out to the parents, being transparent, hey, we do have a problem. And to try to, obviously not all parents can do it, but, try to ask the parents when and where possible, if you could drive your child to school, that can be helpful. And I know that kind of opens up another can of worms, but there's some parents that are able to do it.
The trickiness of that one is that unless they are going to commit for a really long chunk of time to where we know we don't have to account for them on the bus, it doesn't allow us to really combine anything. It does help us when it comes to contact tracing and possibly having to quarantine kids on a bus, because if there's less kids, we can spread them out more. That helps. But we have a legal obligation to provide that transportation. So if we start to plan on longer routes and then suddenly they decide, or their life condition changes or something happens, new job or something, they can't drive their kid anymore, we have to take the child back. So it doesn't really allow us to combine as much as we'd like. Yeah. It helps with the spreading out on the route that's there.
Thank you.
Other questions or comments? Before I take a motion, I do want to say, Dr. Staub and Dr. Mon, I know you guys have been working endless hours to get this done and advocating for our kids in conjunction with the health department. So on behalf of the board, I know we really appreciate that time that you've put in to this.
First, and I want to spread that out because the building administrators and their office staff have been going way into the wee hours doing contact tracing. I know Sarah Massey has been working with us lock and step every step of the way here. And Amy Pelnarsh is an amazing asset for our district. So our head district nurse, Mrs. Pelnarsh, is 1 in a million, and we are blessed to have her. So thank you.
Absolutely. I know we've had administrators working all weekend long, many, many weekends, and we appreciate you doing that for our students and our staff. So with that, I need a motion to approve the intergovernmental agreement for SHIELD COVID-19 testing.
I'll make a motion to approve the intergovernmental agreement for SHIELD COVID-19 testing as presented.
And I will second.
Roll call, please.
Mr. Shaneberg,
Aye.
Voss,
Aye.
Blount,
Aye.
Mr. Cronin,
Aye.
Mr. Skorzinski,
Aye.
Torius,
Aye.
Conquest.
Aye, motion carries. On to discussion and information items. First one is the 2021-2022 school year updates.
And that was what I kind of blended into the last one because it explained what the IGA was going to be needed to do. But I will say it is our hope that next month we can start talking about, updating you on the great things that are actually happening in the buildings, not just the way we're reacting to everything that's happening around us. So talking about how the new curriculum is being implemented, talking about possibly, some early results from map testing or something like that. We want to get talking strategically about how we're improving, the education of our students going forward. So let's hopefully we can get past that reactive and get back to proactive very soon. But aside from that, I would move to the assessment calendar if we could. And Dr. Stopp.
I'll present this again. All right. So the 21-22 assessment schedule has been created, working with our buildings as well. So as you can see, we start the year off with our NWE map assessment, and that, you guys see that, or should I make that a little bit louder? Oh, that is online already. Okay, all right. So we'll start off with our NWA map testing as well as the Ames Web Kindergarten early literacy testing. And then we roll into October with the kids assessment for kindergarten students. In December, we'll do our second round of NWE map testing, and that will take us into January. January, we'll also have our second round of Ames Web for that early literacy and early numeracy for kindergarten. The access testing is for our English language learners, and that begins in January and rolls through February. The dynamic learning maps is the alternative assessment for our students that have significant disabilities and are not able to participate in the Illinois Assessment of Readiness in grades 3 to 8. So that assessment does start in March and it rolls all the way through May. That is an assessment that it takes more than just a couple of days to complete with our students because it is assessing more than just having them sit down and complete things on a computer. It's looking more specifically at their functional as well as their academic goals and skills. So it's very different than the Illinois Assessment of Readiness. And again, that's an alternative assessment for our students who have significant intellectual disabilities. And then we also complete the Illinois Science Assessment for grades 5 and 8, March through April. And then we'll start the Illinois Assessment of Readiness for grades 3 through 8. And that is March through April. And then in April and May, we will have that NWA map. Again, our final one for grades 1 through 8. And that brings us through the end of the year. Any questions on the assessment schedule?
All right, I believe our last agenda item is the school maintenance grant. Mr. Searle.
Yeah, let's try it again. Good evening. I'd like to bring you a update on our 21-22 maintenance grant. In conjunction with the business department, we are applying for a matching maintenance grant up to $50,000. We anticipate we will have $100,000 available to use as early as this summer. Our plan is to continue to improve our security at each building by adding additional card readers to a number of designated doors. The goal is to reach a point that will allow all our regular employees to have cards to swipe for entry and eliminate exterior door keys. This would significantly improve our security at all of our buildings. We have obtained quotes to complete our card reader system, and the anticipated costs are similar to that of our matching grant. Any questions I can help answer?
I will back up and say this is a grant by the state of Illinois. So this comes through the state. It would be considered state revenue. Most years they will offer this school maintenance grant. It's not guaranteed. It has to get approved in their budget. But yes, it's a $50,000 matching grant if they authorize it in the budget.
And the other thing is we took a kind of a high item. So they have like a category system on it, and security is one of the highest. So hopefully we will get that. Anything I can help answer? All good. Thank you very much.
Well, Mr. Searle, why don't you, do you have anything else to add in an administrative report? Because that's the next item.
Sounds good. We'll just keep on going here. Basically, like to give you just a brief update. We've just completed the recommended air filter change on all 72 of our portable air scrubbers. We continue to monitor and repair all of our HVAC equipment in an effort to ensure that we have an appropriate amount of outside air in each classroom. We continue to address and complete a large number of work orders throughout the district. Snow plowing will be put out to bid this week. Our plan is to provide a bid winner available for you to review and vote on in our next board meeting. We will, I guess this is kind of an important one here. We also continue to work on putting together a proposal to replace all the univents at MES next summer. The plan is to convert them to rooftop units, and I'll continue to keep you updated as we proceed on that. Any questions I can help on that?
Did we have any storm damage the other week?
Well, we had a lot of, minimal damage, but no significant damage. We were very lucky.
Thanks.
Thank you.
How often do we replace the filters?
Well, the filters have a self-monitoring system on it, but as we started talking to the company, this is our scrubbers we're discussing, not our regular filters. They had given us an option that other districts were using that kind of shrunk that time frame. We went ahead and took that in an effort to try to, get a maximum effect out of them. So the time limit right now has been, the last run-up was approximately 6 months.
All right, and then just on snow plowing, do we every year get a bid every year for snow plowing? Or don't?
I'll take it. At one point, I think we did a 5-year contract or at least a 3. So we've done multi-year. Last year, Mr. Searle just wanted to go with a 1 year, just to, I don't know why we shrunk it down, but we would have the option of going multi-year, but things change and, services change. And so it almost helps to have the flexibility to do it.
I mean, part of that reason that I shrunk it down was just, that was a learning experience for me. And, getting somebody that's not effective for 5 years is pretty painful. So hopefully the 1 year kind of keeps people on their toes and you get a little bit of a better effect.
You're going to keep it for 1 year?
I am, yes, sir. Yeah.
And with that, did you see from a 5-year to the 1 year a big significant in the change of cost?
And actually, the change of cost can be in our favor. For example, salt is a commodity, and we use an awfully lot of it throughout the whole district. So if you're in a 5-year contract, they have given you a salt number, and you're going to pay that salt number regardless. I like the 1 year, maybe a 2 year, just to keep that possibly in our favor if that commodity drops.
It was really hard to compare last year's cost of snow removal to any other year because it was almost record numbers of like how much snow we actually accumulated last year. So last year we paid a lot, but it wasn't necessarily because the bid was bad. It was just because there was so much snow to remove.
Anything else?
Thank you.
Just to follow up, I think we talked about it before. Are we moving in the direction of being able to do that ourselves, or is that far down the road?
Well, that is an equipment issue and, some degree of manpower issue. We have toyed with the idea of starting to take some of that in-house. There's a lot of logistical problems with that. We do not have a very large staff. That's one problem. The other problem is if we encountered a year like we did last year, it would have been nearly impossible. We just would not have the resources. So having some kind of a partnership is going to have to be the way it works for this district. And, bidding, if it's done correctly, gets you the best price. So it's kind of a, I guess, something we're going to have to kind of look at over time. I don't really have an answer at this point. So.
Anything else for Mr. Searle?
Thank you.
Mrs. Robinson, do you have anything else from finance? Mr. Souza.
Hello. So just a quick update on tech. The teachers at the campus all appreciate the new projectors that we installed. So thank you for approving that back in August or July. So that's basically done outside of a couple outlier rooms that require a big ladder or some other difficulty. So that's been going well. We have been pivoting just to, as we do more and more remote instruction, just different devices, tools, strategies to help teachers. And so we're piloting different things for that, make that more effective. And lastly, I just want to mention, I hope to start bringing you guys in October and definitely the November meetings, kind of like where technology and equipment procurement is going over the next, the next year or even a couple of years. We're going to have some, teacher devices need refreshing, some infrastructure things coming on our way for definitely this upcoming summer and the summer beyond, just to kind of start looking out. Hopefully we can start, like what Dr. Mon alluded to earlier, is looking towards the future into what's coming our way instead of just a constant firefight that we're doing right now. With that, I'll ask if you have any questions for the technology team, or? Okay, thank you very much.
We will not ask Dr. Cheserek to talk about curriculum and instruction tonight. We'll give her a free night since the contract was just approved. Oh, she has to, she's ready to go. All right, never mind.
Hello, everyone. Just let me start by saying it's great to be back. I was gone for a short time, but today was my first day. Some things that I'm working on, I'll be meeting with all the principals this week. Have meetings scheduled. We'll be discussing building level curriculum materials that are still needed, the ELA and math implementation progress so far, professional development that's coming up, and 6th through 8th science and social studies evaluating resources. Curriculum updates. I'll be scheduling grade level ELA and math curriculum developer meetings. I'm meeting with kindergarten on Friday for the day. They're ELA developers. I have a meeting tomorrow with MIS and junior high administrators in Newsella for a quick chat. We have a check-in meeting with Great Minds tomorrow afternoon regarding Wit and Wisdom, Geodes, and Eureka implementation. I'll be sitting in on the Study Sync training with 7th and 8th grade teachers on Wednesday. I have a meeting with the World Book Online group next Tuesday, and I hope to be in the buildings next week. As far as the instructional coaches go, they started their training about 4 weeks ago. It's a 16-week program. They meet every Friday. I do have access to the videos, so I'm working on catching them up to speed here and viewing the videos for the first 4 weeks. I'm meeting with them on Thursday this week, and we'll be discussing the training so far. We will meet every 2 weeks with the coaches for discussion and feedback. We need to develop an instructional coaching implementation plan and providing professional development for the administrators and the teachers. Any questions?
And that's just in 1 day of work. 1 day.
I was
Can you
going to
imagine when we get to 120? Wow.
Thanks for jumping right in for us, Dr. Cheserek.
All right, so I do have a quick question. I don't think Dr. Chadwick, but maybe Dr. Staub, the new curriculum that we started, I mean, it's only a month, but have we had any feedback so far from the teachers and or the students?
I haven't heard significant feedback from our teachers. Dr. Cheserek, I'm not sure if you have in the quick talks that you've had with some of our administrators yet.
Yes, we'll be discussing this week.
Yeah.
But
That's on day 2.
I don't know yet.
That's on day 2.
Okay.
Yeah.
Any other questions? All right, thank
But
you.
that's definitely something, obviously, that Dr. Cheserek is going to be working on, getting that feedback on how it's going. I know that a lot of our staff had participated in trainings throughout the summer, so if they wanted to, and then we've had additional trainings that we were offering during the school year for staff as well. All right, so a couple of things that I just wanted to highlight from the report that you guys all received is that we did start our quarantine learning plan. Working with Miss Massey, we were able to also create a frequently asked questions for our staff to be able to implement that quarantine learning plan. And so that has been rolling out in collaboration with Mr. Souza. He was able to secure some additional license, so our entire district will have full access to IXL and extra math again this year for those students that are on quarantine, as well as those students that are in the classroom. We spoke already about the health aides and how that's something new that we're adding to the district this year. With the ESSER 3 grants, and Mary Robinson has been outstanding at working with our ESSER 3 grants. So we had $2.4 million in that grant that we're utilizing. And I know I shared quite a bit of the funding or the resources that we're purchasing through that, but our big focus is learning loss. And the feedback that we're receiving from the staff on our learning loss is that our younger students specifically are coming in not with those readiness skills because they weren't exposed to preschool. So that is a challenge in our district right now, is making sure that we're supporting those kiddos that have never really been out of the home environment because they didn't have access to preschool for the last year and a half. So those are some things that we're wanting to make sure that we're supporting our younger students especially. We'll do a full review of exactly where we're finding gaps once MAP testing has been completed, this first initial go round, so we can look at where else do we need to target supports and services for our kiddos. One other thing that I wanted to bring your attention to is our social emotional needs assessment. Several of our social workers and a few of our school psychologists are going to join together this fall and start a social emotional needs assessment where we're not only going to look at the tools and our supports that we currently have in place, but evaluate what are some additional, is there additional curriculum that we should bring? Is there additional supports? Are there any additional resources that we could bring to our students here in district to make sure that we're meeting the current social emotional needs of our student? So I'm very excited to see the results of that committee. And the last area that I wanted to highlight was the accountability for special education. In Illinois, part of ISB is we have indicators for our special education areas, and it looks at our student population that have been identified as needing special education services, and it tries to ensure that, one, we're in compliance with everything, that all of the special education regulations, but it also looks at our students to ensure that we are not over-identifying students in any specific subgroups of our population, or that we're not over-identifying students in any areas of our, with any specific eligibility area. So I'm very pleased to say that we came out with flying scores in our review, and that's something that, again, I think our staff is really good at identifying our students for the supports that they need while keeping the students in the least restrictive environment that they possibly can. So I was very pleased when I received that, that even during all of the difficulties that we've lived through in the last 18 months, our staff have still continued to serve the populations that need those special education supports. I believe that's all I had tonight.
I have a question for special education. I know in the past, some students were like, they'll be in a different classroom, and they're being dealt with in special education setting, and then they'll go into general education. With COVID, is that still happening?
Last year, we were pretty creative on how we were providing services. So we tried not to have students move around too much because we wanted to keep them in their little bubbles. This year, we've been able to be a little bit more flexible in that, so we are providing the services as written in the child's IEP. So if the child needs services in the general education classroom, either an aide or a teacher is pushing into that gen ed classroom, if the student needs to be pulled out into a separate environment, we are able to pull them out into that resource environment now.
Thank you.
I have a question as well. How long after the MAP assessments will we have an idea of what some of that learning loss is? So once we finish the assessment phase, the current timeline, about how long, will you be able to report out at maybe like the next board meeting, or is that too ambitious?
I think the next board meeting is the exact target that we can use. I have never pulled all of that data myself, so this will be my first year doing all of those calculations, but I look forward to that. Many of the administrators like to lovingly call me a data dork because I really like that. But so that's something that we'll be diving into. I'm pretty sure we'll be able to pull all of that data real time once we close the testing window. So I should be able to have all of that for you guys at the next board meeting without any problems.
That is awesome. From one data dork to another, I am excited to see that. Thank you.
Thanks.
Yeah, and remember, that's the benefit of MAP, is that we get almost real-time information. We do need to close the testing window for the district before we can start to get big aggregate district reports, but it's fast, much more useful than the large state assessments that we take and get data like 6 to 7 months later. All right, I don't really have any additional administrative reports. I do want to put a plug in. I believe our junior high softball team is going to state on Friday. So best of luck to the softball players there. Has baseball started their tournaments yet? Yep, I caught a brief bit of that game before the board meeting, and I think I saw a run score. But all right, so congrats to baseball on the way to sectionals. So we'll start to see some of these fall sports seasons wrap up, and hopefully our teams can have continued success as the state tournaments get going. Because if you recall, one of the things about our junior high being as large as it is we don't have access to the conference tournaments anymore. Because we're just that much bigger than every other school in our athletic conference. So we get to play some games during the season, but this is our tournament season now. So go Minooka, go. So I don't have anything else, and we don't have anything for executive session tonight. I do anticipate executive session in October. So.
Okay, any board topics?
I do have a question. Those communications, kind of going back to the testing and providing that cheat sheet, are those communications also provided in Spanish? Can we work with our bilingual team to make sure that, families have access to that?
Yes, our multilingual coordinator, I spoke about her in my report, Erica Martinez, has just been phenomenal at reaching out anytime that we've been working on our communications. She started reaching out and saying, hey, remember, use me, and she will translate any of those documents for us.
I'll also say the communications platform that we use called School Messenger, it has a translate button. So whenever we send messages out through that, I've been hitting translate on the ones that come through me. So that is definitely available for all of the School Messenger options that we send out.
This is just a random board suggestion. Something I heard through the bad weather time was now, I don't know if it was always this way, but 111 is it comes from the same text number. So I don't know if that's something we could kind of spread through the district. When you have kids in multiple districts, you don't know what district is sending you the alert. So if it doesn't say Min 201 or Min 111, I forgot to bring that up earlier, but I did get a couple of messages about that confusion. Any other topics? All right. If there's no other topics, I need a motion to adjourn the meeting.
Motion to adjourn.
Second?
All those in favor say aye.
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 Opposed, nay. Motion carries. We're adjourned.